Hello and welcome to YouTube channel HealthQ, the place where our mission is to not only motivate you but help you to move on to the brighter side of the health. I'm your host physiotherapist Meghna Dave, and in today's video I'm here to talk about a very technical topic but would like you to understand, and that is range of motion exercises. Now whenever you go to physiotherapist, your physiotherapist usually prescribe you some exercises. These exercises are of different varieties and is done for different reasons. This exercise starts from range of motion exercise and then varies to stretching exercises and sometimes strengthening exercise. My idea behind doing this video is to give you an understanding of the science behind the range of motion exercise and other exercise that we prescribe to you during your physiotherapy session. And that's why I would be doing this video in 3 parts, where I would be talking about first range of motion, followed by stretching exercises, followed by strengthening exercise. So this video is the part 1. If you want to know the science behind physiotherapy, why physiotherapists prescribe you exercises, what are the benefits of exercise, then this video would definitely interest you. So without wasting any due time, let's get started. Friends, range of motion exercise are basically done for 2 purposes. Number 1 is to first check or examine how much movement you are able to do. And second, to initiate movement, which means to start a movement at a joint or else at muscular level. Range of motion means how much a joint or else a muscle is able to move. Joint range of motion basically talks about ability of a joint, how much a joint is able to move. For example, let's say if I talk about my wrist, the range of motion is all the possible movements that this wrist is able to do. So in wrist, I am able to extend it up till here, and I am able to bend it or flex it till here. I am able to move it on the side till here, and I am able to move it inward side till here. I am able to rotate this wrist as well. So all this ability of my wrist to do movement is called range of motion. Similarly, the muscle range of motion is the ability of a muscle to expand and then come back to its norm. It's also called as contractile property of a muscle. Hence, full range of motion or complete movement that we are able to do at the joint level is called joint range of motion exercises, and the movement or muscle, how much we are able to elongate and bend, is called a muscle range of motion. So mostly the exercises that we design are kept in mind, are we working at a joint or else are we working at a muscle level. Now whenever you are doing any exercises, there is a goal behind it. As I mentioned, the goal is to initiate movement, which means that we want to kickstart a movement. This kickstart could be after paralysis. This kickstart of the movement could be after an injury recovery, or else it could be in kickstarting of a movement after a degenerative pain change has happened and you were under an acute problem or acute pain, and now you are training yourself to come back to your routines. At these scenarios, range of motion exercises are ideally used. Now, why this range of motion is so important? Now just imagine if you are not able to raise your hand completely, that means you are having a limited range of motion, which means all the joints have certain functions, have certain movements. These movements of the joint allow us to do our day-to-day activities and day-to-day tasks. Whenever there is a pathology or else a problem, as an individual you lose this ability or else you find limitation in doing this ability. That's when your range of motion gets affected and impairs your quality of life. For example, let's talk about shoulder. In shoulder, we can raise till complete high. We can raise our hand outside, we can take it back, we can move it outward and inward. Due to these actions which are available in our shoulder, we can lift an object, we can push an object, we can throw an object, we can pick or push or do so many tasks along with it. Why this is possible? Because the joint is moving in its functional range. Now just imagine, if due to a pathology, this ability or this range gets affected, you won't be able to move that joint independently, actively. That's why it's important that each and every joint, each and every muscle should be able to move in their functional range, and to allow this movement to happen, we do range of motion exercise. Now the question arises, what are the different types of range of motion exercise? Now broadly speaking, range of motion exercises are of three types. Number one is called passive range of motion exercise. Number two is active assisted range of motion exercise. And number three is active range of motion exercise. Now as the name suggests, passive range of motion exercise stands where you, or else as an individual, you are not doing the exercise by your own. Some external force from outside is making you to do that movement or that activity. Then it becomes a passive exercise. Mostly if you have some sort of limitation in movement where you are actively or by yourself are not able to do the movement, that's the time when your physiotherapist will recommend you passive range of motion exercise. Passive range of motion exercise is ideally prescribed in scenarios where an individual is paralyzed, or else there is a fracture or else a severe injury where active movement is not recommended, or if the pain is so tremendously high that you are actively not able to do the movement. In these three scenarios, mostly passive range of motion exercise is given. The advantage of passive range of motion exercise is pretty safe because you are not actively moving, so the force or the tension that is falling on the muscle would be less. It is good to start or initiate the movement, especially in the state of paralysis. And number three, it helps in re-educating and retraining the patient or as an individual how to do a movement, because the next person or the third person is making you do the activity in the right direction. So these are the benefits or advantages of doing the passive range of motion exercise. But along with that, there are some limitations as well. The limitations are, number one, it does not help you to increase the strength of the muscle. Passive range of motion exercise will never increase the strength of your muscle. Number two, you have to be dependent on somebody else to do this activity. You cannot do it by yourself. And number three, it gives a limited learning. It is very well said and proven in many researches that when we put our own effort in learning something, the learning is better than a passive effort. That's why passive range of motion exercise does not give good learning effect, and these are the limitations of it. And that's why it's ideal to do active assisted range of motion exercise. But active assisted range of motion exercise again are indicated or can be done in certain scenarios. Let's say if you are recovering from paralysis, let's say if you are recovering from your fracture, or let's say you are having a limited pain now, the pain has got better. That's when your physiotherapist can put you on active assisted range of motion exercise, where there is partial amount of effort which is put by you and partial amount of effort would be put on by the therapist or else your caregiver. So here the force that is required to create a movement is being distributed between two people. This will allow the movement to happen, to initiate in a much more better way. There is an involvement from your end as well, but from a safety standpoint, from a learning standpoint, there is an external force, there is an external thing which is guiding you to do the movement. So ideally this is used in scenarios of rehabilitation where the patient or as an individual is in recovery stage or else is in a phase where there are moderate symptoms, moderate pain, moderate movement or limited movement. The advantage of doing this is you are involved into this. So definitely your learning would be way more better about the movement. Your understanding, your feedback about the movement would be better than the passive scenario. And the third benefit is you can put more effort as per your ability. So you can judge by yourself. So there's more good sensory feedback here. That's what is advantage of taking active range of motion exercise. But there are limitations again. As I said, active range of motion exercise also requires some external force. So it is not something where you can do it independently. Number two, your learning of movement will still stay limited because there is an external force which is also involved. It would be better than passive but not 100%. And third limitation is you cannot strengthen your muscles here as well. And that's why active exercises are the ideal ones. Now, active exercise, as name suggests, are the exercises that you do by yourself. These are the most popular form of activity where you are moving your joint in your normal range by yourself without any external force, without any resistance. Most probably you will use the resistance of the gravity. Active exercises are a very good way to start your therapy, especially when you are recovering from injuries, when you are recovering from an acute or chronic pain scenario. Active exercises helps to involve your brain 100% in the motion. It is well said, where you put your mind, that muscle grows. So if you want to improve particular body area in terms of strength, in terms of flexibility, in terms of movement, you need to put your force, and with the help of active exercise you can do that. The second benefit of doing active exercises, the learning is better. Each and every movement, whatever you do, sends signal to the brain about that movement, and that brain area gets stronger about its memory. And that's very crucial, and that is the base on which we are able to do our day-to-day task. Most of the time when a person experiences paralysis, they experience the loss of memory of that movement pattern, which is very important to be retaught in the rehabilitation phase. And that's where active exercises also comes into the picture. And third thing, active exercises are the way to improve muscle strength. So these are the benefits of active exercise, but it has limitations as well. Number one limitation, risk of injury. If you are doing active exercises, especially in the early or acute phase of your injury or rehabilitation, there could be a risk of doing wrong movements, tricky movements that could lead to injury. Number two, you have to take ownership of your techniques. Your techniques would be controlled by you here, even though there is a command, but the action is done by you. So you have to be careful with that. And number three, again, for strengthening, you need further resistance. So active exercise in general also don't give a lot of strengthening effect, definitely beneficial than passive and active assisted, but still they are not as strength creating exercises as resisted exercises are. Active exercise, active assisted exercise or passive exercise, they are part of your rehabilitation or recovery process, which are very crucial for you to recover from better mobility, to recover from your injuries or problems for better mobility. If you understand these basics, whenever you will talk to your physiotherapist, you will very clearly understand and know why exercises are so important. The idea behind creating this video is to make people understand that physiotherapy is not just about machine or not just about someone doing something passively on you. It's a way deeper science where your involvement plays a very crucial role. I hope through this series of videos, I am able to create that understanding for you. On that note, I'll end this video here and I'll see you in another video. Thank you.